Hi everyone, I wanted to talk to you about cranial nerves. The brain and the spinal cord are part of the central nervous system, but cranial nerves are part of the peripheral nervous system. And there are 12 pairs. Some of these nerves carry sensory information, some carry motor information, and some carry both. They're mixed nerves. It is helpful sometimes when you're learning cranial nerves because you need to remember all of the names as well as their Roman numeral, also whether they carry sensory motor or both types of information. So sometimes it's useful to use mnemonics, and so I've included a few here. These first two, O to taste a fruity vodka, go visit a hotel, and on old Olympus towering top, a friendly Viking grew vines and hops. Those are two mnemonics that will help you remember the cranial nerves in order. The first letter of each word corresponds to the same first letter of a cranial nerve, and it's in order. You'll also need to know whether the cranial nerve carries sensory, motor, or both types of information. So I have another mnemonic for those. Some say marry money, but my brother says big business matters more. So the S's would stand for sensory, M for motor, or B for both, a mixed nerve. The first cranial nerve is the olfactory nerve. It's a sensory nerve that detects your sense of smell. So here is a median view of your nasal cavity right here. So you breathe in odorants here, and then those odorants will bind to receptors on your olfactory nerves right here. And so here are your olfactory nerves, and then they transmit information to your olfactory bulb and then your olfactory tract. When you're doing a brain dissection and you're looking at the cranial nerves, it's easy to confuse this olfactory bulb with the olfactory cranial nerve, but this is in fact not the actual nerve. But if you're doing a brain dissection, the olfactory nerves have likely been destroyed in the process of removing the brain from that cranium. So you can see the bulb in a brain dissection, but frequently not the actual nerves. The actual olfactory nerves are found right here, and that would be sensory information. Cranial nerve 2 also carries sensory information. It's the optic nerve, and it carries visual information. So you have ganglion cells located back here on the retina, and these cells will converge to become to help form the optic nerve, which you see here and here. Past the point of this optic chiasm, you have an optic tract, and so you see here this would be part of the central nervous system because it's named tract, but up here the optic nerve is that cranial nerve, part of the peripheral nervous system. You can see this information heads on back to the thalamus and then back to the occipital lobe. We'll talk about that pathway later when we discuss the special senses. The third cranial nerve is the oculomotor nerve. Oculo referring to the eye and motor for movement. Oculomotor nerve is responsible for the movement, the innervation for the muscles of the eye, the extrinsic eye muscles. So if you look at this picture over here, you see the eyeball, and there are muscles located outside the eyeball that are responsible for rotating and moving the eyeball. And the oculomotor nerve is responsible for innervating several of these muscles that you see here. So here's your oculomotor nerve right here. It originates in the midbrain right here. It also helps to control the upper eyelid. The trochlear nerve, cranial nerve number 4, is also a nerve that controls an extrinsic eye muscle, and it specifically controls the superior oblique muscle right here. The reason it's called the trochlear nerve is because the superior oblique muscle, its tendon loops around this area right here before it attaches to the eyeball, and that loop is called a trochlea or pulley. So that's where the trochlear nerve gets its name. Trochlear nerve also originates in the midbrain. Trigeminal nerve is cranial nerve 5. And this is a mixed nerve, so it carries both sensory and motor information. It's called trigeminal because it has 3 branches. It originates here in the pons, and you can see there's one branch, the ophthalmic branch, that heads to the eyes. There's a maxillary branch that heads to the maxilla, the upper jaw, and a mandibular branch that heads to the lower jaw. So it has 3 branches. The sensory aspect of the trigeminal nerve deals with your sensations of touch, pain, and temperature. And then the motor aspect of it will supply the muscles that are involved in mastication or chewing. And you can see here this trigeminal nerve, this branch, your mandibular branch that supplies your lower jaw. It has this part of it that runs past the ear, and so you'll see infants as they're teething will frequently scratch at or pull on their ear, and that is because this trigeminal nerve runs right over the ear before it heads toward the mouth. Here's another picture of the innervation of the trigeminal nerve. You can see this area controlled by the ophthalmic branch of the trigeminal nerve, this area controlled by the maxillary branch, and then down here the mandibular branch. And then here's a more extensive view of how those branches synapse. Inflammation of cranial nerve 5 is trigeminal neuralgia, also called tic douloureux. It is the most excruciating pain known to man. It's a stabbing sensation. It can last just a few seconds or it can last a full minute, but it occurs all day long, 100 times a day. And it's provoked by sensory stimuli, which could be brushing your teeth, eating, or even just a passing breeze. So there are analgesics, pain relievers, there's surgery, or if it is really severe and there's just nothing that's helping, you can destroy the nerve. And in this case, you would lose the sensory sensation, which is really what you're going for. You want to get rid of that pain that's happening 100 times a day. But you would also lose your ability to, some ability to chew. You're losing the motor aspects as well. Lose sensation in that part of your mouth. So I only would do that for severe pain, obviously. Abducens nerve is cranial nerve number 6. It is another motor nerve that controls an extrinsic eye muscle. You can see it originates in the pons, and then it heads on to control the lateral rectus muscle. Innervates this extrinsic eye muscle right here. So we've talked about the oculomotor nerve, the trochlear nerve, and the abducens nerve. These all are responsible for controlling extrinsic eye muscles. The facial nerve, cranial nerve 7, is a mixed nerve. The sensory part receives sensation from the anterior 2/3 of the tongue, those taste buds, and the motor portion comes from the pons, and it controls the muscles of facial expression. So it innervates all of these muscles that enable you to show happiness and fear and sadness and so forth. Here's another picture that shows the extensive innervation of the facial nerve, all of the different facial muscles that it innervates. If you have inflammation of the facial nerve, this can be due to Bell's palsy. This causes paralysis of your facial muscles and partial loss of taste sensation. Remember that sensory aspect of the facial nerve. Your lower eyelid droops, the corner of your mouth sags, which makes it difficult to eat or speak normally. Corticosteroids can help to treat that inflammation, and recovery is complete in almost all cases. So here is a picture. On the left side of her face, you can see the forehead is wrinkled, the corner of the eyelid is up, the corner of the mouth is up. On the side that is affected by inflammation, you can see the corner of the mouth droops, the corner of the eyelid droops compared to the left side, and this forehead is smooth because there's no muscle tone there compared to the left side. And so here in Bell's palsy, you see pretty much the whole right side of her face is just slightly drooping down. It's slightly more relaxed compared to the left side that's unaffected. The vestibulocochlear nerve is cranial nerve 8, and that is a big word, but there are 2 main parts. Vestibulo is referring to your vestibular system, which is your balance system, balance and equilibrium, and cochlear, referring to the cochlea of your ear for hearing. And you can see that this nerve is actually made of 2 separate nerves. You have the vestibular nerve here that heads to the vestibule, and it carries impulses for equilibrium. And then here's the cochlear nerve that carries impulses for hearing. And then these 2 combine to become the vestibulocochlear nerve. The glossopharyngeal nerve is cranial nerve 9. Glosso is referring to tongue. Pharyngeal is referring to the throat. This is a mixed nerve as well. Sensory axons carry signals from the taste buds on the posterior part of the tongue, and the motor neurons come from the medulla, and they deal with swallowing as well as salivary release. You can see how the glossopharyngeal nerve synapses here. See the sensory aspects coming to the tongue, and then motor fibers come to the salivary glands. Here's your parotid salivary gland right here, and then also to the pharynx, which is responsible for swallowing. The vagus nerve is cranial nerve 10, also a mixed nerve. The sensory aspect deals with many different sensations like proprioception, which is where your body is located in space due to the positioning of the joints, so the flexion or extension of joints, abduction, adduction, and so forth, and stretching. So it gets information from stretch receptors as well. Almost all the motor fibers of the vagus nerve are associated with the parasympathetic nervous system, and they act as effectors to carry out some task. Vagus translates as wandering, and you can see in the next picture it's a very long nerve, and it has many different fibers. It's distributed from the head and extends all the way into the neck, the thorax, and the abdomen. The motor neurons come from the medulla, supplies the pharynx, larynx, soft palate, and so speech and swallowing are also going to be due to vagus nerve innervation. And so here you can see from the medulla, here comes the vagus nerve, synapses, it has fibers that come to your pharynx here, your larynx where your voice box is. You've got your heart and your lungs, and so the vagus nerve will be responsible for regulating breathing and heart rate. Many digestive organs have fibers that synapse here. You've got the stomach, the liver, the intestines, the kidneys, and then also the spleen. It receives information from baroreceptors that detect blood pressure, chemoreceptors that detect chemicals, especially carbon dioxide, taste buds, and proprioceptors, monitors the position of those joints. And before I forget, the monitoring position of joints may not seem like such a huge thing, but if you're exercising, for example, those joints are going to be moving frequently, and so it is an indicator to your body of exercise if you're moving your joints. So it can adjust your heart rate and breathing appropriately. Accessory nerve is cranial nerve 11. It's also called the spinal accessory nerve. It's primarily motor, and there's a little bit of debate on whether it's actually a cranial nerve because it actually emerges from the spinal cord, not the brainstem. And then it comes into the skull through the foramen magnum. So you can see here are the rootlets, and then here is the accessory nerve that it comes from. So it does go into the skull through the foramen magnum, right there, but it originates from the spinal cord. It supplies the sternocleidomastoid as well as the trapezius muscles, helps to coordinate head movements. So this is a motor nerve. Number 12, hypoglossal nerve. This is a primarily motor nerve, and it is going to conduct nerve impulses for speech and swallowing. Originates on the medulla, and you can see hypo means below, glossal is referring to the tongue, so you can see it comes right up under the tongue, right there, hypoglossal nerve. So just as a reminder, you do need to know the names of all of these cranial nerves. You need to know each cranial nerve also by Roman numeral. They are traditionally referred to by Roman numeral, not Arabic numeral. And then you'll also need to know whether they carry sensory information, motor information, or both if they're a mixed nerve. And everything in the slides, as always, is fair game. Please let me know if you have any questions.